Good afternoon, ladies and gentlemen, and welcome to your health program, You and Your Health, aired on Equinoxe Radio Multimedia. And for presentation, I am Esia Lucy Liengu. It remains the leading cause of death globally. Nearly 16 million new cases and 5.7 million deaths are registered each year across the world. In Cameroon, high blood pressure is a major risk factor and primary cause of stroke, particularly among the Cameroonian population. This is as a result of several factors which we are going to be looking at today. Today we will be looking at how stroke and high blood pressure are related. With me here in the studio is our guest. But before introducing our guest, my co-host for the day is Immaculate Fogre. Good afternoon, Immaculate.
Good afternoon to you, Lucy. Good afternoon to you, Doctor. And good afternoon to our viewers and, of course, televiewers. Thank you so much for choosing Equinoxe Radio Multimedia.
And it's always a pleasure having you, Ima.
Same here.
All right, and in the studio already is our special guest. He is no other person than Dr. Cabral TANTCHOU. Good afternoon, Doctor.
Good afternoon, Lucy. Good afternoon, Immaculate.
Thank you very much, Doctor. You are a cardiologist practicing here in the city of Douala. I would like to understand, firstly, what is high blood pressure and how is it measured?
Yes. High blood pressure is let us say a disease that you mentioned about statistics, you mentioned about the situation of Cameroon, and you mentioned one of the complications of high blood. It's a disease diagnosed with some parameters that are very important to take, and those parameters are the ones that can say if someone is having hypertension or not. We should know that blood circulates in the human body with a particular pressure. When blood is sent in the vessels, when there's contraction or systole, there's one pressure that is registered when in the vessels. And when the heart relaxes or in the diastole, there is also one pressure that is registered. Basing ourselves on the two readings, we can say if someone is having hypertension or not.
All right, so what are some of the common causes of high blood pressure which you experience on day-to-day at your hospital?
Definitely. Usually when people are asking the causes of hypertension, when you diagnose, probably you see a young man that is coming with very high figures of the blood pressure. He will be asking you, why, doctor? What is bringing this problem? What is this? What is that? Sometimes there's no cause. There's really no cause. It just starts like that. Or we know that hypertension definitely is the disease of people that are above 55 in male, and something, yes, in male, and above again in women, something like 60 in women, 55 in men. When someone is something like 30 years old and is having high readings, it's really a disaster, let me say it like that. But there are many here in Cameroon or in consultations of all cardiologists with young people that are having hypertension. The causes, there are hypotheses. Yes, because when you analyze everything together, you are not really finding a particular cause, but all people that are presenting with particular types of parameters or particular types of changes in their system can develop hypertension. That's why we are talking about risk factors, which are sedentarity. People that don't do physical exercises. In them, the blood pressure can be high. That's why it's very, very important, really, to do physical exercise. Age, we are mentioning about age, and the sex. Male, about 45, 50, and women, about 55, 60, is when they are prompt to develop hypertension. Okay, habits. People that are smoking, people that are drinking, these are people also that can develop, in whom we can see hypertension. Also, the race, Africans.
What about stress, doctor?
Stress, I'm coming to that. Stress also contributes a lot to hypertension. Feeding habits, people that eat much salt, they are developing also hypertension. That's why hypertension is not only taking medication. Yes, it's good to take medication, and there are many medications for hypertension. It's also to change the lifestyle. That one is very, very important. Again, it's worth mentioning that hypertension is like, there are many hormones in our system, some those how can I call them again? Biological active liquids that are fluids that are really functioning or circulating in our body. Sometimes they just, they are sick, they decrease, like we can say in pidgin. Yes, that, this one is much, that one is less, that one at a particular time it just start like that. This one is much, this one is less. This dysregulation, hormonal dysregulation, that is what is bringing really hypertension. And that's why there are many groups of medications that can lower the blood pressure. And it should be low, and we should maintain it low. If not, the complication that you just mentioned, like stroke, that, someone that is not, we say it in cardiological language, hypertensive is not controlled. Yes. Each person that is taking this medication for hypertension should be controlled. The blood pressure should be controlled. What is mean that the blood pressure is controlled? The systolic, when the heart pumps, it should be less than 129 millimeters of mercury. And the diastolic should be less than 89 millimeters of mercury. That one is very, very important. And people that are having diabetes, or people that are having renal impairment, the systolic should be less than 119 and the diastolic less than 79. These are the thresholds that each cardiologist is using to follow up cases. If not, people, you should do your best. You should do your best and take your medication, because it's so, when you talk again about hypertension, it's so big, it's so huge, it's really a big domain that,
it's broad.
Yeah, it's very, very broad. That's sometimes complicated for patients, or also, if you are in you have a poor background, if that is what is making things to be complicated. And again, I should say it, our government should do something for citizens, for Cameroonian citizens, yes. Because there are some people that in the very beginning, they're taking medications. Yes, they're taking, and the breadwinner dies. It cannot anymore. And it's how now complications come in. Meanwhile, someone that was really all the time, regularly, he was not failing his checkups. But now, the bread is no more. We do have, and the patient dies. Not only that, because when someone comes for, we should start the treatment or the management of the problem, there are some tests that you should request. Yes. The majority, there is no cash, there is no money to do those tests. It's sometimes very, very complicated. Yes, in our setting, very, very complicated. That's why we studied in some other countries, foreign countries, and again, in some countries of Africa, yes, where when they are coming, everything is free of charge. That one, yes, you see how the government really takes care of its citizens, and you see how, mortality or morbidity, you're not finding just people carelessly dying. No.
Right.
When you are asking for tests, everything is done, and it facilitates work, and you are going for the best option for patients. Can you imagine that some are coming, you say, oh, because the person is limited, you are giving for giving's sake, that he came to the hospital, he should take this, he should take that, knowingly that this one will just suppress something, will not really help. You see, this is the condition that we are facing.
Okay, for those who like to participate on today's edition of the program, here are the numbers: 670-5470-49. I repeat, 670-5470-49 or 656-622222. 656-622222. Back to you, Dr. Cabral. How does high blood pressure affect the cardiovascular system?
High blood pressure in many ways affects the cardiovascular system. You see, when the blood pressure is stable, or when the blood pressure is having acceptable readings, the vessels are safe. You see, when it's very high, it changes the walls of the vessels. They become more.
We have a call on the line. We'll come back to you. Hello?
Hello?
Yes, sir. Your name, where you're calling from, and your question.
Hello?
Turn off your receiver, please. Turn off your radio or your TV set, please.
Okay, are you getting me now?
Yes, go ahead.
Hello. Yeah, I'm calling from Bonaloka.
Okay.
I just want to ask from the doctor, what is the difference between the heartbeat and the high blood pressure?
Okay, gentlemen.
Thank you.
Gentlemen, I forgot your name. The heartbeat and the blood pressure are two different things. The heartbeat is what is the electrical activity of the heart. There are two sounds, S1, S2, loop-dum, 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 loop-dum. Is how it is, the heartbeat. Meanwhile, the blood pressure is the pressure that blood is having when it circulates in our vessels. Yes. This is the main difference. But the two, they go together. Sometimes when the heart rate is accelerated, since the pressure as it's accelerating, the pressure now in the vessel will be low, and you can have syncope, like people that are having palpitation, people that are having sudden death. Yes. Then the heart will just start beating fast, and whoop, they die.
Okay.
Yes.
Now,
Why? Because the blood pressure is too low and no oxygen is reaching the brain, etc.
Okay, back to our question. We're talking about how high blood pressure can affect the cardiovascular system.
Yes. High blood, I was saying that at the level of the vessels, let us start at the level of the vessels. The vessels, they are having a particular thickness. They are having a particular flexibility. When the blood pressure is too high, that thickness, the vessel become thicker. It's like a defense mechanism. So we are hitting, something is hitting. Fibrosis is developing itself inside, and it will not be flexible as it was before, and it becomes thicker. And as it becomes thicker, the blood pressure also is where now, if you are not having medication, probably something too bad will happen. And again, as it becomes thick like that, there are some other vasoactive fluids.
We have another call on the line. Sorry. Hello,
Doctor.
Yes, gentleman.
Yeah, please. I just want to know precisely where you are working, your office.
Okay. I'm in St. Padre Pio at Aqua Nord.
St.
Padre Pio.
Okay, Aqua Nord.
Yes.
Okay, thank you. Because I want to meet you there.
Okay, you're welcome.
Yeah,
and those changes are happening in all the arteries of the body, at the level of the heart, at the level of the brain, at the level of the kidneys, at the level of the eye. And that's why when the blood pressure is not controlled, you are having that type of problem. Later on, the sight. That's why we're talking about noble organs, target organs. Your eyes will have problems. You will not be seeing anymore well. Why? Because the retina is having problems with the vessels. They are thick, and the changes at the level of your vessels of the eye, are altered. That's why now you have problems with your eyes. You will not see well anymore. At the level of the heart, those changes also, because the vessels now is too thick. And sometimes there's a fatty deposit. And that's all them combined. And with those biological active also fluids that will be coming in your system, you will have myocardial infarction or heart attack. And depending now on the heart attack, the time that you are having it, or the place of the heart that is having the problem, you can die immediately, suddenly. Let's talk now about the kidneys. The same problem the kidneys are having, and that's why you can develop kidney failure. Not to talk now about the lower limbs. Yes. Very soon you have gangrene of the limbs. Yes, that's why it's very, very important. We have been hammering in this studio. We have been talking about hypertension, and we will continue to be talking about hypertension. Why? Because complication that it brings, if people will know, I'm sure that the majority will escape, and people will not be joking with their medication anymore.
Okay, Doc, is there a relationship between hypertension and stroke?
Definitely. Stroke, if really you're not taking a medication for hypertension, definitely, with this mechanism that I just explained, tick, and later on it bursts. Okay. It's not flexible anymore. The vessel bursts, and that's all. You are having hemorrhagic stroke, or it can be ischemic stroke because, you know, a blockage of a particular vessel, and how the brain cells will die, and you'll not be fine. Or you will die, or you have invalidity. One side of your body for long will have a problem.
Okay.
So what are some of the warning signs? Let's focus on some of the warning signs of stroke that individuals experiencing high blood can encounter.
Very, very important. First, your medication. If you're not taking your medication every day as the doctor requested, yes, you can develop stroke. You should know that before now these symptoms, like headache, violent headache. It can be frontal, it can be back head, your head, you know. Yes, if you are having that violent headache, a blurred vision, you were seeing well and suddenly, you know, it looks like you are not seeing well anymore. The speech, you are talking well and, you know, people are realizing that that speech is not coming out well anymore. And your sight also, it can be the upper limb, the lower limb, it can be the left or the right side. You see that, you know, the movements that you were doing, you cannot do them anymore. That one is an alert. Yes, you should go direct to the hospital.
All right.
Let them take your blood pressure. Let them try to really sort out what is going on.
All right, doctor, in few words, let's have the last advice for our viewers out there. In few words.
If you are hypertensive, take your medications. Take your medications, and we have been talking here about lifestyle changes for people that are having hypertension. Just abide to those regulations and you will be fine.
Thank you very much, Dr. Cabral TANTCHOU, for accepting to be our guest on today's edition. It's always a pleasure having you in the studio.
You're welcome, Lucy.
Thank you very much, Immaculate Fogwe.
It's always a pleasure, Lucy.
Thank you, ladies and gentlemen. We have been discussing about the relationship between stroke and high blood pressure. For presentation, I am Asia Lucy Liengu and was technically assisted by Bertrand Bonzini and Jonathan Babiola at the technical dashboard. Ladies and gentlemen, do stay in the company of interesting programs on Equinoxe Radio, Show Television. Bye-bye for now.